Hello, my name is Becca Doshi.
Hi, and I'm Pennie Grubbs.
And this is How to Talk to Children About Fanconi Anemia. Pennie and I are child life specialists at Cincinnati Children's Hospital. Our job is to decrease the stress and increase coping for our patients and our families. We do this through evidence-based practices such as therapeutic play, normalizing the environment, providing education, and sensory preparation. Our objectives today are to explain FA using developmentally appropriate language, provide appropriate wording to explain various treatments and procedures, discuss barriers to coping by developmental age, and to provide some tips on discussing death and loss. So we understand that receiving a diagnosis of Fanconi anemia can be overwhelming, to say the least. And with that comes the stress of trying to explain everything that it entails to a child. Although it can be tempting to want to avoid the conversation, we would really urge you to be honest. Opening yourself up to these conversations can really set the groundwork for all of their future hospital experiences, whether it's them as a child experiencing FA or whether it is them watching you as you are going through all your treatments. Your child will really learn that they can trust you and believe in the things that you say if you continue to be honest. Now, when talking with your kids, it's really important that we use simple and concrete language. Hospitals can use a lot of jargon and medical terms that can be really confusing to children. So try your best to break the terminology down into bite-sized pieces. Use graphics if it's appropriate. So Google can sometimes be your best friend in showing your child some of the things that you or they might experience. It could be really helpful to show them a picture of a CT scan, for example, an IV, or a picture of a cell like one you'll see in our next few slides. Now determine the appropriate amount of time. You know your child best, and every child is different. So for an older child, you might opt to set aside a period of time in the day to have your discussion. But for a younger child, it might be better to have a short conversation that goes over the length of several days. And this is because a younger child may only want to talk about it for a few minutes before moving on to another subject or wanting to go play. And that is totally okay and appropriate for them to do. They might not have any questions or comments in the moment, but they might bring it up randomly when you're sitting around the dinner table. And as long as you leave yourself open to the child revisiting the conversation, any amount of time that you're discussing can be fine. And then finally, we want to invite questions. So you want to ask your child, do you understand the things that I just told you? Or ask them to repeat back what they think that they heard. You can ask them how it makes them feel, and then ask them if they have any questions for you. So next, we wanted to go over some of the specific examples of wording that you can use when explaining the different aspects of FA, whether it be the disorder itself, the bone marrow transplant, and various procedures. So below is a way to start the conversation. So Fanconi anemia, or FA, is a blood disorder. It means that the body does not make enough healthy blood cells. And then Pennie's going to walk you through a few others.
All right, so again, like Becca said, we're going to try to give you some language, some ways that you can talk to your children that might be helpful in their understanding. And honestly, it helps me too sometimes to just break it down. So what is a cell? Our bodies are made up of trillions of cells, and they're very, very, very tiny, and we can only see them under a microscope. So our cells work together like building blocks or like Legos, and we know our kiddos can relate to that. And all together, our cells are supposed to help our body stay healthy and strong. So we like to use the terms of blood factory when we talk about the bone marrow. So think of our body like a blood factory. The bone marrow is that spongy part in the middle of our bones, and that's where the factory is that makes the blood. And inside the blood, there are worker cells, sometimes called stem cells, inside that bone marrow. And they have they have really important jobs because they make 3 different types of cells that our body needs. And for patients with FA, that's where the problem is. Their body is not making all of those healthy blood cells. So let's talk about the three types of cells. We have red blood cells that carry oxygen from our lungs and carry it all throughout our body so that our body can work and function like it should. And then we have white blood cells that fight infection and they protect our body from the germs coming in. So you'll hear somebody's white blood cell count is up. That means it's trying to fight off some type of infection. And then the other type of cell are platelets, and those form clots to stop bleeding. So normally we get a cut or a scratch, we bleed temporarily, and then it stops. If you don't have the platelets that you need, then you might continue to bleed longer than you should. So here's just an example of illustrations that we might use with kids. For us as child life specialists, we often create diagnosis books that might be for our patients, it might be for the siblings, just to help understand what's happening in their bodies. So again, we talked about the three different types of cells, and you can see that our red blood cell, is working hard and carrying that oxygen through the body. And then we have our white blood cell that is a fighter because he's fighting off infection. And then we have our platelet that is forming the clot. So sometimes it's just helpful to have a visual. And I think kids can relate to that. They're used to cartoons and those kinds of images. So we like to use that. So a lot of our patients with FA will go to bone marrow transplant. So that might be your child, or it might be you that has FA and is having to prepare for a bone marrow transplant and also prepare your child. So what is a bone marrow transplant? It is basically when healthy cells are given to replace the sick cells in the body of a patient with FA. So those can come from a donor, like an anonymous donor, or they can come from a sibling. For patients with FA, the sibling seems to yield the best results because we know it's a genetic disease, and so it comes from both parents. So if you have a sibling, they are most likely going to be the best match for a patient. So it sometimes can seem a little anticlimactic. You're preparing for the big bone marrow transplant, and it is huge, but it doesn't always appear that way. The cells will hang in a bag from like an IV pole, and those good healthy cells are going in to replace the sick cells and make all of the cells work together in a healthy way so that the body can function as it should. So what are you going to feel after a bone marrow transplant? I think it's important to know and just to be able to prepare, whether that's preparing your child for what you might be going through or preparing your child with FA. So after a transplant, patients often feel extra sleepy, and that's very normal. And I like to tell patients that just means their body is really working hard. It's working hard to get all those healthy cells going. And so it just needs extra rest. Most patients will lose their hair during that time because they're also receiving chemo, which is a medicine that is also fighting the bad cells. I like to remind our kids, our patients, that their hair will grow back. When they stop taking the medicine, the hair will grow back. We try to do things to just comfort them during that time if it's an issue for them. There are some kids who it's really not, but a lot, your hair is very near and dear to you, and it's difficult to lose that. So we provide extra hats and wraps and things. And here, as child life specialists in Cincinnati, we do a special hair fairy thing and make a whole, big deal out of it. Also, sometimes you might feel grumpy one minute, we like to tell kids, and they might feel happy the next. Those, back and forth of feelings can be very normal, but it can feel very unsettling to a child or to an adult. So those can be very normal. Also, you might have some mouth sores or your belly hurts. And again, that just means that your body is working extra hard and there are changes going on in there. But be sure to talk to your child about those things and talk to your nurses, because often they can give you some medicines to just at least help alleviate some of those symptoms to make you feel more comfortable or make your child feel more comfortable. Okay, so then we want to just talk a little bit about how to explain procedures. So we know that with FA, your life may include a lot of medical procedures, a lot of medical health encounters. And so we just want to give some tips for explaining procedures. So we want to, again, focus on simple, concrete language. And I know Becca talked about that. And we just often want to ramble. We want to give more information than is necessary. And often kids don't need a whole lot. So give them a little, make it concrete so they understand it, and then wait for questions. We want to often focus on the senses, the 5 senses, so kids can understand that. They can relate to that. They want to know, how is this going to impact me? So before procedures, we like to tell them what they might feel, what they might see, what they might hear, touch or taste or smell. So if they're getting an MRI, we might prepare them, telling them that it's going to be really loud. It might kind of sound like you're in a washing machine, but you're safe and there's nothing touching you. You know, how a flush might feel or taste in their mouth, things like that. We want to just prepare them as much as possible. Again, along with the simple concrete language, we talk a lot about being honest. So be honest as often whenever you can. So if there's going to be pain involved in a procedure, you need to tell them that, but you can use words that seem less threatening. So utilize words like, it might feel uncomfortable, or it might feel unusual. It might feel like a poke or an owie. You know, those words that your child understands, but be honest if there's going to be maybe some pain involved in it. Prepare. We believe that knowledge is so important and really helps children coping. As Becca mentioned, you know, you can decide when it's appropriate to talk to a child and prepare them. Sometimes you don't want to do it a week ahead of time. You don't even want to do it a day ahead of time, sometimes for smaller children. As children age, you have a little more time to be able to share that information, to give them time to process and maybe give them time to think of questions. But we want to prepare. As child life specialists, we do a lot of medical plays. So we might take a teaching doll or a puppet into a room, and we take the supplies that child is going to see in their procedure. So they're familiar to them. It gives you an opportunity to I guess, communicate with them and hear any, maybe they have misunderstandings or they think things are going to happen that aren't going to happen. And you have an opportunity to talk through those things. You also have an opportunity to model positive coping. So even at home, I will often recommend to families to just get out a doctor's kit, play with their stuffed animals. It doesn't have to be real directed. Pull out some of those medical supplies, you know, the ones that you might have at home or things that we can send with you. And then model positive coping. You know, Teddy's doing a great job holding still. Way to hold your body still. Way to take nice deep breaths, things like that. So prepare whenever possible. Practice those things that they're going to have to do. Holding still for long periods of time might be a good thing. You can practice a little statue with. Give them jobs. So we believe that promotes coping. So I might tell a child that you have 2 jobs today. Your first job is to hold your body still, and we can help you with that if you need it. Your second job is to take nice deep breaths, and Becca's going to talk a little bit more about that later. But you know, those kinds of things that they can do that you can assign to them. Remember your jobs, okay? And then be an advocate. Advocate for your child. You know your child best. You know what works and what absolutely doesn't. Obviously, it will be, you know, it will be a group decision, but we want parents involved. We want you to tell us the things that you know about your child that might be helpful, whether that's does best when only mom speaks, or does best the fewer people touching and holding, things like that. So we trust you and we want you to feel comfortable advocating for your child. And then last, just tap into your resources. Look at your hospital's websites. There's often prep books on there, like tips for preparing your child for a surgery, things like that. Use your resources, your people, whether that's your child life specialist, or you might have a music therapist where you are. You might be fortunate enough to have holistic health. Those are all different people that could be on staff. that could also add to your experience and make your child's experience more positive. All right, so Becca's going to talk a little more about development and just the different developmental levels and how that affects your child's coping.
Thanks, Penny. Okay, so starting off with infants. So for infants, separation from a caregiver can really create a lot of stress. Infants also thrive on having a routine in order to learn how to sleep and eat and self-soothe, but unfortunately, having scheduled appointments or spending the night in the hospital can really be disruptive to that routine. Sensitivity to abnormal stimulation. So when you're a patient with FA, it might feel as though you're constantly being poked and prodded all the time. And this is obviously an unwelcome stimulation for a developing infant as well. So ways to help them cope include using a rattle or a similar type infant toy, playing soothing music, or using a white noise machine to drown out some of the sounds of a hospital, allowing a pacifier. Now, we know that a pacifier is not always a parent's first choice because it sometimes becomes a struggle to have to take it away as they get older. But at this moment in time, when you are faced with all the stress of a hospital, it can be a really welcome tool in helping them to learn how to self-soothe. Now, some hospitals might even offer something called Sweet Ease, which is a sugar water solution specifically designed for a pacifier to be dipped into, and that also helps to calm a baby. Or you might even consider breastfeeding during invasive procedures or encounters, because research has actually shown that this can really help to decrease the amount of stress that an infant feels. Now, if you are inpatient, you can also ask if there could be a designated time of day where hospital staff can try to stay out of the room, because this can really allow for your baby to have some much needed and uninterrupted sleep. And then finally, it's important to try to increase their positive touch experiences, since a lot of those touch experiences can be viewed as negative for an infant. So making sure that you're taking the time to rock and cuddle, or even doing infant massage can be really helpful. So for toddlers, toddlers often have more receptive than verbal skills. So this can lead to frustration for a toddler, as they're not always able to communicate everything that they want you to know. So at this age, they are all about control. Most of us parents have heard their toddlers say like, me do it, or I do it by myself. But unfortunately, there are not many things that a toddler can control in a hospital environment, which could be very frustrating for them. Many toddlers experience separation anxiety or stranger danger, which is very challenging when so many hospital staff need to be coming in and out of the room all the time. And then finally, toddlers have an egocentric view of the world, which means that it makes it really hard for them to see any other viewpoint other than their own. So ways to help them cope include developmentally appropriate toys such as cause and effect toys, glitter wands, bubbles, or even light spinners, because they can help to distract and entertain your child. You can also try singing or reading their favorite book to them. Again, if you are spending the night in the hospital, advocating for an uninterrupted quiet time as much as if possible is also another great idea. And then finally, try to offer choices if you can, if an actual choice does exist. So a choice like, would you like to take your purple medicine or your pink medicine first? Or which arm should we do your arm hug, your blood pressure in? Those are great options for real choices that a toddler might have. Moving on to our preschool age group. So preschoolers are magical thinkers, and this can mean that hospital experiences can appear even scarier than they actually are if we're not taking the time to explain everything that is happening to them and around them. So for example, I had a patient who had a port that was placed in their chest, but had not been given proper education and preparation. And so he believed that the nurse was trying to poke a hole in his heart. And so it was important in that moment for his parents and I to go in and to try to explain what a port actually does and why he has one, and why in fact the nurse was not trying to poke a hole in his heart. They also have an increased understanding of their body function. So this can sometimes be a good thing in helping them to understand what's going on to them, but also could be more stressful when dealing with FA because of that understanding. So they also understandably have a fear of pain in their blood. Medical procedures can also be seen as a punishment for preschoolers. And so we really need to take the time to make sure that they understand that they are not getting this poke because they did anything wrong, but in fact, they need it in order to do a certain function. And then finally, we need to make sure that we are providing these explanations because preschoolers have a very literal interpretation of language. So for example, an intravenous catheter, which we refer to as an IV, could be confused with ivy, the plant that I see growing on walls. Or a dressing change could be confusing because they might think, well, why are they trying to remove my clothes? Instead of explaining that, oh, this means that they're giving me a brand new clean bandage. So for procedures, using look and find books can be a great distraction. So can pinwheels and party blowers because they can really help the child to learn how to engage in deep breathing. And that helps their body to relax. So just like with toddlers, they still enjoy bubbles and glitter wands and light spinners. Sometimes telling them a story of maybe about a favorite vacation, something that really happened, or just an imaginative story, and encouraging them to participate in the storytelling can really help take their mind off of things. And this is also a great age to introduce a stress ball. You can teach your child to hold it and to squeeze it whenever they are feeling sad or upset or feeling something that they do not like. And then of course, using a tablet or an iPad is also great. For school age kids, they are increasing in their independence. They are able to verbalize their feelings and they can clearly tell you when they do not want to do something. They're also interested in learning new skills. So this could be useful if their new skill is something that lends itself to being inside a hospital environment, like knitting or something like that. But it could be pretty devastating if their budding interest is in an outdoor activity like horseback riding or fishing or a sport, because now they're stuck in these hospital walls and they don't get to do those activities. Their friendships are very important and they might worry about their loss of status with their friends due to missing school or because of the way that they look. So when they're experiencing a procedure or invasive encounters, it can be really useful to use I Spy books to help take their mind off of the matter at hand, or maybe telling them a joke or a riddle because that can help to distract and to promote laughter. As with most age groups, tablets and iPads are also great distraction tools. You can teach your child some deep breathing techniques. So teaching them to breathe in by smelling a flower or to breathe out by cooling the soup is a great and useful skill. Guided imagery is also another great technique to teach at this age. One of our favorite exercises is to ask the kid to imagine that they are anywhere in the world, their favorite place. And then you lead them through the exercise by asking, well, what do you feel right now? Do you feel the wind blowing? Do you feel the warm sunshine? Do you feel the water? What smells do you smell? What can you see? Other kids might enjoy journaling or doodling their hospital experiences as a way to process. And then finally, if you are spending the night in the hospital, you might consider FaceTiming or video calling their friends or the families because that can make all the difference. And then our final age group are adolescents. So for adolescents, their peers can be even more important than family to them. This is an age for increasing independence with learning how to drive and becoming an adult, but sometimes having FA and the various things that those entail can kind of alter those timelines for them. Now, they might experience a sense of denial with their medical experiences, or they might refuse to take certain medications or be compliant with their appointments. They could potentially feel awkward with medical examinations, especially ones that expose sensitive body parts. So do your best to help them feel comfortable. This could mean closing the curtain, buying them clothes that help them stay a little bit more covered up, or even stepping out of the room if they prefer. If they have physical differences due to their FA condition, they could feel self-conscious or kind of hyper-aware of their appearance. And then this is also an age for an interest in sexuality to develop. Now, ways to help your teenager cope include writing, playing or listening to music, guided imagery and deep breathing, giving them opportunities to process their feelings with you or another trusted adult, and giving them chances to distract themselves with virtual reality, an iPad, a laptop, or video games. Now, with all these age groups, one thing we also wanted to mention would be considering siblings. If it is you yourself who is inpatient at the hospital dealing with FA, or your child is dealing with FA and you are there helping them to deal with everything, oftentimes siblings can feel neglected because the attention is not on them as much. And so it is important to remember some of these ways to help them cope will also definitely apply to the siblings as well. And making sure that we are spending special time, maybe one-on-one with them, or making them to really feel special and heard, giving them those opportunities to process, giving them time to FaceTime. All those things can be really helpful. Okay.
Great, thanks, Becca. And now we're going to talk about just kind of coping with some of those physical differences. They can be physical, or we know there are things that maybe that can't be seen, but sometimes our patients with FA can have an abnormal heart or lungs, or there can be issues with their digestive tract. And we know there can be physical differences. There can be a loss of thumbs, or some different issues with forearms and shorter stature. So we know those things are real, and we know that children notice them. So for school age children, we just want to be honest and recognize that other children might notice, might comment. So maybe help your child come up with a script and help them to be prepared for any of those questions. How are they going to respond? What are they going to say to that? So they're not taken back and off guard. Talk to your children about their similarities too. Sometimes when we're feeling negative, we're so focused on the negative and the things that we wish that we were, we forget, and how we're different. We forget how similar we all are. So help your children to see that, the similarities between them and their peers. Highlight their strengths, of course, and involve a teacher, your social workers, your school counselors. They can do curriculum that is that will talk about the way that children can be different, the way that children are the same, and acceptance and all those kinds of things. And also, if your child is just individually really struggling, or even to the point of being bullied, you want to make sure you pull in those resources and those extra people that can really benefit your child, especially if they're there in the school setting and seeing them. For our adolescents, be honest. I mean, they know what's going on. They know how they're different. They know how they're the same, but you want to just acknowledge their reality and how difficult it might be, validate their feelings, express, that you understand, or that, that you at least empathize with what they're feeling. Brainstorm ways maybe to get out of difficult situations, because we know it's a fact that patients with FA are more susceptible to cancers like throat cancer, and head cancer when they are involved in using alcohol, tobacco substances, those kinds of things. And we also know that that's a time when kids are experimenting, they're feeling peer pressure. So help them figure out, how do I get out of those situations? Because we know they can be detrimental, even more detrimental than to just your child without FA or without another type of chronic illness. So be real, really talk about those things, because we know that they could come up and they could be in those situations. So maybe come up with a code word. Some people will recommend that child to keep them from feeling awkward or standing out even more, because we know they don't want to do that. Have them send a code word in text or a phone call that's one word that they know they can say to you, and all right, I'm coming to get you. So that's just one idea, but prepare them, because those situations could definitely arise. And then last, we just want to talk about navigating death and loss. And we know these are hard things to talk about. And whether that's you as a parent with FA that is dealing with end of life or it's your child and you're preparing for that, use simple, concrete information. Avoid language that's confusing. As adults, we might say they're, passing away, which makes perfect sense to us, but it may not make sense to a child. So it's okay to use the word die or to use the word death. Because again, we want to be concrete and we want to be simple, and that helps a child prepare. Talk about how it's okay to feel a range of emotions, because there can be anger, there can be sadness, there could even be some relief. There's such a wide array of emotions, and then children can feel guilty for feeling one way, not versus another. So just talk to them about the acceptance of all those different feelings. And there's no guidebook. What you feel is what you feel. So help them to learn to cope with those feelings. Create opportunities for memory making and legacy building. So we obviously want to do those things, whether it's a parent that the child is losing or a parent that's losing a child. You want to have special things that you can hold on to and you can save. For us as child life specialists, we might facilitate that by doing hand molds or handprints with the patient and family members. There are lots of ways that you can do that through writing, other things. So they're great things to have for later and down the road, but they're also opportunities to spend time together and make memories. So don't miss out on those opportunities, because I know they can seem difficult to do and get through. But if you're able, there's some great things you can do there. And hopefully if you're in the hospital setting, there's staff that can help facilitate that and coordinate those things for you. Involve a counselor or therapist. We know that grief is a difficult process, and can be a very long process that involves lots of stages and lots of emotions. So get help. Again, use your resources. If you can get a counselor involved, please do that. Locate grief support groups. There are lots of great ones out there. So if your child is losing a parent or you're losing your child, look for support groups, ways that you can feel connected to other people with the same shared experience. I think Becca mentioned a little bit about the siblings, and just we know that whether it's a parent that has FA or it's your child, it's a family, it's a system that is connected and that is affected. So we don't want to lose sight of that. We hope that some of the language that we've given you, some of the ways that we've talked about FA and that journey and what that might look like, we hope that you can use those with your child, you can use it with their siblings. That we've answered some of the questions that you might have been thinking. So, but we are here, and we're just going to open it up to questions, comments, and we'd love to try to continue this conversation.